coronavirus may have originated from laborers who worked in a Chinese mine nearly a decade before the pandemic began, a U.S. expert has claimed. Dr. Jonathan Latham, executive director of the US Bioscience Resource Project, believes COVID-19 may have evolved in the body of infected workers working in the Mojiang mines, in south-central Yunnan in China. In April 2012, 6 mine workers were admitted to hospital with coronavirus-like symptoms after working in a bat-infested cave. 3 eventually died. According to Dr. Latham, the virus that eventually became SARS-CoV-2 and caused COVID-19 may have evolved inside the bodies of these miners before escaping into the population, through samples of the disease that were sent to researchers in Wuhan. The emergence of the Alpha variant in Kent last year from a single immunocompromised patient, he suggests, is evidence that the virus can make strange evolutionary leaps when inside an individual for a long time. Speaking at a British medical journal, BMJ, webinar, Dr. Latham said, the theory requires many hundreds of mutations in one miner to turn into SARS-CoV-2. Decades were crammed into about 6 months. But we have heard of the surprising phenomenon of isolated cases of greatly accelerated evolution in viruses in Britain. As much evolution occurred in that one individual in England as had occurred in the millions of other infections. Our theory proposes that a similar evolution was happening inside the lungs of miners following the Mistral disease in 2012 and argues that the virus leaked from a medical sample obtained from the miners infected by the outbreak. About 1,500 kilometers from Wuhan, the Mojiang mines are home to several of the lab origin theories surrounding COVID-19. Back in 2012, the workers fell sick after scrubbing a copper seam clean of bat feces and were admitted to a hospital in the provincial capital of Guiyang with persistent coughs, fevers, head and chest pains and breathing difficulties. Medical records at the time concluded the 6 workers, aged between 30 and 63, were victims of a SARS-like coronavirus contracted from horseshoe bats, Reuters reports. When scientists returned to the mine at the end of 2012, they found samples of a pathogen that came to be known as the Mojiang virus. The Mojiang virus is found in rats and unrelated to SARS-CoV-2, and it was not confirmed whether it was behind the miners' illness. Since then, China's top bat coronavirus researcher, the Wuhan Institute of Virology's WIV, Shi Zhengli, has said that the workers' pneumonia-like symptoms were caused by a fungal infection and that there was no sign they had been infected with SARS-CoV-2. But the case of the mine workers has been used by those supporting the idea that a coronavirus very similar to SARS-CoV-2 could have been infecting humans as early as 2012. First identified in 2016, a virus named RATG13 was discovered from the anus of a horseshoe bat in the same caves. According to a paper by Shi and other researchers, RATG13 shares 96.2% of its genome with SARS-CoV-2 but must have diverged 40 years earlier. The new theory by Dr. Latham suggests that the evolution from a virus such as RATG13 could have occurred far more quickly inside the body of a miner. Dr. Latham said, "We know that coronaviruses were diverse and abundant near the mine, and we know that some of the miners underwent lengthy hospitalizations. Their treatment lasted 6 months and allowed the evolution of novel adapted human coronaviruses." We know many medical samples were sent to the Wuhan Institute of Virology, so the question is, what was in the samples, and what was done with any viruses that were found? China and WIV have strenuously denied allegations that coronavirus escaped from a Wuhan laboratory, but Alison Young, the Hurley Chair in Public Affairs reporting at the Missouri School of Journalism, said lab leaks of dangerous viruses were common throughout the world, The Telegraph reports. She said, "Lab accidents are not rare. In the US in 2020 there were 134 reported lab exposure incidences of viruses, bacteria and toxins that the US government regulates." Lab accidents and exposures happen frequently. Read more. Read more.